it keeps the foal asleep by working on the GABA receptor, the same thing that barbiturates and other things worked on. So back in the 80s, 1988, was the first meeting of the International Perinatology Society, and I got a chance to meet with Peter Rosdale and establish a nice relationship and talk about his earlier work and his brilliance with really the father of equine neonatology. And he just measured everything. And it was a very informative. So I went back and read some of the literature. This is from the 1950s, and with Mahaffey and Rosdale, and they called this a convulsive thing, syndrome. And then they talked about the maladjustment syndrome. He used that name. And the little arrow here says it's associated with particularly rapid and easy birth, often precedes the onset of maladjustment. And it says that we don't know, they don't know much about it, but it occurs where there's human intervention. That's in his other slides. And where foals are born outside without intervention, it's not recognized that somebody goes out and sees a foal wandering around. So he threw those observations out, which I think were helpful. And the other thing about Dr. Rosdale, what a scientist, and what a great, I had a chance to meet some of the colleagues I worked with, Marion Silver, Abigail Foden, and Jenny Hussey, and others. And then he teamed up with this group in Oregon that had mass spec, and he started measuring all these different progesterone things. Because you go to these repro meetings, if you don't mention progesterone, you're not part of the club, you know. It's just all the endocrinology is big, that right, Juan? I mean, we really beat the progesterone drum there. And then we'd have a little bit of talk about the neonates. But Peter, he just put this stuff forward, and he shows in this slide here that in the placenta, progesterone goes to allopregnanolone, and then in the fetal brain, it goes to allopregnanolone. And what does allopregnanolone do? It keeps the foal asleep by working on the GABA receptor, the same thing that barbiturates and other things worked on. This is from 1991, but we didn't put 2 and 2 together here. And here he's showing abnormal foals. These are way up here with total progestins. So other people way back then were seeing these endocrine abnormalities involving progesterone, but we didn't know the neurochemistry of the thing. So they didn't even have names. This 5-alpha pregnane 20 alpha ol 3-1 is allopregnanolone, and they did not know at that time that it worked on the GABA receptor. Lots of work, you know, has happened since then.